Let's get to our morning rounds. The office of Joe Biden announced Sunday that the former president has been diagnosed with an aggressive prostate cancer. A statement says that Biden reported urinary symptoms, which led doctors to find a nodule on his prostate. This morning, we are talking with a prostate cancer expert, Dr. Will Parker. He is a urologic oncologist here at the University of Kansas Cancer Center. Dr. Parker, of course, we need to acknowledge that you are not involved in President Biden's care. You have not seen his chart, but his office did release some details. They said the cancer cells have spread to his bones. They said that it had a Gleason score of 9, grade 5, and they said that the cancer appears to be hormone sensitive. So start us off, a Gleason score. What is that, and then what does a score of 9, grade 5 mean?
Absolutely. So the Gleason score is a way to gauge how aggressive the cancer may behave. And the scale, the Gleason score itself runs from a 6 to a 10. And then we transition those to these grading nomenclature, which is 1 to 5. So a Gleason 9 or grade 5 is unfortunately the highest you can be on that scale, which means the most aggressive form of prostate cancer that you can have.
The statement said that Biden and his family are reviewing options, treatment options. Does that Gleason score dictate treatment options then?
Well, really what it dictates is the need for additional testing. So one of the things that his office relayed is that it has appeared to have spread to the bone, which means that they did the necessary imaging that we would expect for a Gleason 9 or grade 5 prostate cancer to understand the extent of the disease. So while it doesn't necessarily dictate the type of treatment, it helps guide us towards the diagnosis and the extent of the problem.
So I have to ask, if it's so high, does that mean it just was never caught in any testing, former testing or screenings before?
Well, certainly, as you mentioned, I don't have access to his chart, so I don't know what routine testing he was doing. That said, most guidelines actually recommend stopping PSA testing, or PSA, that's blood testing for prostate cancer screening, when men get above 70 or 75 years of age. So it's possible that he was not undergoing routine PSA testing as appropriate per guidelines. And unfortunately, he was diagnosed with an advanced form of prostate cancer based on symptoms.
Got it. Okay, so the age, that would make sense. So because the cancer appears to be hormone sensitive, they're saying it can be managed even though it's aggressive. So what does that management look like?
So the hormone sensitive really underscores what the mainstay of management is. So prostate cancer is a hormonally sensitive cancer in most stages of its life, which means that testosterone stimulates growth, and suppression of testosterone can suppress the prostate cancer's progression. So the backbone would be some form of hormonal suppression, and then often we'll add other medications on top of that hormonal suppression to achieve better control.
Dr. Parker, always good to have you with us. Thanks so much for your insight this morning.
Thank you.